The goal of this presentation is that you're able to recognize the 3 basic types of ostomies and provide care for them. What is an ostomy? This is a cute little comic here. You have a blockage, which is interrupting your normal flow of intestinal fortitude. An ostomy is a surgical procedure that involves the removal of diseased portions of the gastrointestinal or urinary system and creation of an artificial opening in the abdomen to allow for the elimination of bodily waste. More than 700,000 Americans, from infant to senior citizens, have had ostomy surgery. Over 120,000 people each year have fecal or urinary ostomies. An ostomy procedure is essential for colorectal cancer, bladder cancer, Crohn's disease, ulcerative colitis, birth defects, and other intestinal or urinary medical conditions. Also, ostomies are necessary in certain cases of severe abdominal or pelvic trauma. In recent years, there have been an increase in such traumatic injuries suffered by soldiers on active duty in the military. An ostomy can be life-changing. For individuals suffering from such conditions, ostomy surgery is both life-saving and life-changing. Again, it is a surgical procedure, opening through the abdomen where the intestine is brought up to the skin and sutured in place to form a stoma. This is to bypass diseased intestine or bladder. The 3 most common types is the colostomy, the ileostomy, and the urostomy. The colostomy is formed from the colon. Indications, again, are trauma, cancer, diverticular disease, Crohn's disease, ulcerative colitis, or obstruction. Here's a lovely picture of the gastrointestinal system from top to bottom. Portion of the diseased large intestine is removed or bypassed. The remaining portion is brought through the abdominal wall to form the stoma. This can be temporary or permanent. If temporary, stoma will be necessary until the diseased portion can heal, which requires another surgery to reconnect. Different colostomy sites. This is what you see externally all the way to the left, with a bag all the way to the right, and that x-ray view front and center. A fresh operated stoma. This type of stoma would be hard to maintain skin integrity due to its inset placement in adipose tissue, but there are different supplies you could use to build up around that stoma to keep the intestinal contents away from the skin. It is important to empty the pouch when 1/3 to 1/2 full. Change the pouching system twice a week or immediately for leaking. You can shower with the appliance on or off. Do not use baby wipes to clean around the stoma. The patient or student will need a new wafer, but if you use wipes, it may not stick. Clean peristomal skin with a moist washcloth. For cleaning, you'll need water, Soap is discouraged. No diaper wipes. Product wipes made for adherence if needed, and less is more. Ostomy products are made to adhere to the skin. Stomas can change size, so be sure to measure after surgery or with any weight changes. It is important to use the correct size appliance. Cut it to fit each individual stoma. The wafer or adhesive barrier should fit snugly around the stoma, about 1/8 of an inch close. Use a barrier ring or paste only if necessary. Some newer wafers are formed to fit and they turtleneck up to the stoma. An example of a wafer, a cut to fit wafer. It's like arts and crafts. This is a stretch to fit appliance. Different types of stoma. So one to the left that's flush with the skin. Center is butted or protruding. And then to the right is inverted. Examples of unfortunate skin breakdown. Crusting is recommended. The technique for this is clean, dry skin, apply stoma adhesive powder, sprinkle, dust off with gauze or a paper towel, dab with no sting barrier wipe. Repeat the process 3 times. Keep effluent off peristomal skin while applying the crusting technique. You can hold a absorbent gauze right over the stoma opening while doing this process. That way you're wicking up any stool or intestinal contents that are leaking from that stoma site. Examples of a healthy stoma and peristomal skin. Paste has alcohol. If needed, let dry for 1 minute for evaporation of alcohol before applying to skin. Barrier rings preferred. Warm first, apply to skin, can fill in crevices and provide protection of peristomal skin. Fit right next to stoma. Here's an example of a barrier ring. Stoma adhesive paste, also known as Adapt. You can have a 1-piece or 2-piece ostomy bag system. If it is a convex stoma, there are bags made specifically for that extend into the stoma cavity more than others. Drainable or closed. Your ostomy pouch has to be drainable. Ileostomy pouch has to be drainage. Colostomy pouch can be closed-end or drainable. Medicare provides 20 wafers and 20 drainable pouches per month, or 60 closed-end pouches. Closed-end versus drainable. Here are samples of 2-piece ostomy bags, 1-piece, and drainable. A stoma that comes from the ileum is an ileostomy, usually on the lower right of the abdomen. Effluent is loose to liquid with enzymes. There's more issues with leaking and breakdown of peristomal skin with ileostomies. There's typically more dietary restrictions and potential blockage problems. Examples of an ileostomy. The entire colon, rectum, and anus are removed or bypassed. The small intestine, ileum, is brought through the abdominal wall, creating the stoma, most often on the right lower side. The stoma is smaller in diameter. The fluid is loose to thin and more difficult to contain. Some average diets would be to encourage more water and fluids, 10 to 12 glasses per day, avoiding nuts, popcorn, seeds, celery, corn, or high fiber items. Raw, crunchy vegetables must be chewed very well. Eat slowly and chew all food well. Avoid time-released or enteric-coated pills. For a blockage, go to the ER. For difficulty or constantly draining stomas, have the patient or student eat 2 tablespoons of peanut butter if ordered, or eat 6 large marshmallows if ordered by the provider. Please wait 30 minutes before changing an appliance. This will slow down the drainage so you can get a good seal on the device. Urostomy, the bladder is removed or bypassed. A conduit is made of the small intestine tissue. Ureters are implanted into the ileum and on the urostomy stoma. The urine flows from the stoma into the pouch appliance. Some facts about urostomy. The intestine produces mucus, therefore the urine will have a cloudy appearance and the mucus will need to be cleaned off the stoma during appliance changes. Adequate fluid intake, 8 to 10 glasses a day, is very important. The need to connect to an overnight drainage system. White, gritty deposits on and around the stoma are typical. Clean peristomal skin with 1:1 vinegar and water. Clean overnight container with vinegar and water. The percentage of occurrences. Questions?